Today, we are diving deep into one of the most prescribed antibiotics on the entire planet, azithromycin. We're going to break down the incredible science behind this little pill that so many of us know.
I mean, think about it. Have you ever been prescribed a Z-Pak? Chances are, if you've had a really nasty bacterial infection, your doctor probably handed you a prescription for one. It's practically a household name, and for good reason. So, what is it that makes this drug so incredibly popular and, more importantly, so effective? Well, that's what we're here to figure out. We're going to uncover the powerful science that makes this tiny pill a real medical heavyweight.
All right, first things first. How does azithromycin actually stop an infection dead in its tracks? To understand that, we have to shrink down and go to the microscopic level, right inside the bacteria themselves.
So imagine every single bacterial cell has this tiny little protein factory inside it called a ribosome. And this factory, it is absolutely essential for that bacteria's survival. It builds everything the cell needs to live, to grow, and, crucially, to make more copies of itself. Well, azithromycin is clever. It sneaks inside the bacteria and latches on directly to that ribosome factory. And once it's there, it basically jams up the whole system. Think of it like throwing a wrench into the gears of the production line. Everything just grinds to a halt. No new proteins can be made. Now, this brings up a really important distinction in the world of antibiotics. By stopping that protein production, azithromycin is primarily bacteriostatic. What that means is it stops the bacteria from multiplying, which gives your own immune system a huge advantage to come in and clear them out. But get this, at high enough concentrations, it can also be bactericidal, which means it just kills the bacteria outright.
Okay, so we know how it works at the cellular level, but what makes azithromycin so special? Why this drug over others? Well, this is where its absolutely brilliant delivery system comes into play.
The drug has this incredibly clever trick up its sleeve. You see, it gets absorbed by our own white blood cells. And those white blood cells then act like a Trojan horse, carrying this hidden payload of antibiotic directly to the site of the infection before unleashing it. It's ingenious. And the power of this delivery system is just wow. It means the concentration of azithromycin in the infected tissues can get 10 to 100 times higher than what's just floating around in your bloodstream. That is an incredibly focused attack, hitting the bacteria hard right where they're causing the problem.
But that's not its only superpower. The other key to its success is its staying power. Azithromycin has a really long half-life. We're talking about 68 hours. That means it stays active in your body, continuing to fight that infection for days after you've taken the very last pill. And that right there, that long half-life, is the secret behind the famous 5-day Z-Pak. You take a big double dose on day 1 to get the drug levels up fast, and then a smaller daily dose is all you need to keep it going, because you know that medicine will keep on working long after that pack is empty. It's just really smart pharmacology. So, with this powerful 1-2 punch of a smart delivery system and a long half-life, what kind of infections is the Z-Pak actually used for? Well, it's got a pretty wide range. It's known as a broad-spectrum antibiotic, which means it has a pretty long hit list. But where it really shines is against something called atypical bacteria. These are the tricky ones that like to hide inside our own cells, like the bugs that cause walking pneumonia or chlamydia. Of course, it's also a go-to for a ton of common things like respiratory infections, skin infections, and those awful middle ear infections. Okay, but as effective and amazing as it is, no drug is without its risks. And it is absolutely crucial that we understand the potential side effects and the really serious warnings that come along with azithromycin. Because it's an antibiotic, its job is to kill bacteria. Unfortunately, it can't always tell the good from the bad, so it can disrupt the normal, healthy bacteria in your gut. And that means the most common side effects are, you guessed it, things like diarrhea, nausea, and stomach pain. But now we have to talk about the most serious risk, and this one demands our full attention. The FDA has issued a black box warning that is its strongest possible warning because azithromycin can, in some people, cause abnormal changes in the heart's electrical rhythm. This can lead to a potentially fatal condition, and the risk is higher for people who already have heart problems. And that heart risk gets magnified when you take it with certain other medications. For example, combining it with some antipsychotics or other heart rhythm drugs can seriously increase the risk of a dangerous arrhythmia. It can also interfere in a big way with blood thinners like warfarin or heart medications like digoxin.
So, all of this leads to a final, critical list of precautions. It is absolutely essential that your doctor knows if you have any of these conditions, especially a pre existing heart condition or severe liver disease. And of course, you have to tell them if you have a known allergy to this whole class of antibiotics, which are called macrolides.
When you step back, azithromycin is really a masterpiece of drug design. It's incredibly effective and uniquely convenient. But that convenience is balanced against some very real, very serious risks. And it makes you wonder, right? It forces us to ask a really important question. How does the sheer simplicity of a 5-day pill change our relationship with the powerful and potentially dangerous medicines we rely on every day?